Men die 5 years younger than women, and the number one reason is not what you Men die 5 years younger than women in almost every country, every culture, every income level.
Wow, 5 years. That's not a small gap. What's causing it?
It's not genetics, it's that men refuse to get checked. Today we try to fix that.
So, a quick note before we start. Again, this podcast is only educational and not a personal medical advice. So, if you're dealing with any symptoms or taking any medication, please get in contact with your doctor. Should we start?
Yes. Today we are covering everything men needs to know. Prostate, heart, sexual health, and screening. All the things men should be talking about but are not.
So no embarrassment, no judgment, just information that could literally save your life.
Because the most dangerous thing a man can say is, I'm fine.
And I will repeat this. The most dangerous thing a man can say is that I'm fine. And they say it every day.
Yes. And welcome back to GNL Podcast Real Life Non-Gloss. I'm Dr. George.
And I'm Lena. So this is episode 11, and we will speak about men's health masterclass. We covered hormones broadly in episode 5, but today is specifically about condition, screenings, and risk that affects the men. Women, don't skip this one. If you have a husband, father, brother, or a son, this episode might help you to get them to the doctor.
That's actually one of the most common ways men end up getting screened. Someone who cares about them pushes them to go. And don't forget that globally men live about 5 years less than women. Usually in USA it's approximately 73 years versus 79 years old.
So why is that? Is it genetics or how come?
Partially. Estrogen provides some cardiovascular protection that men don't have. Men also have higher rates of risk-taking behavior. But the biggest modifiable factor is healthcare engagement. Studies suggest men are approximately 24% less likely to visit a doctor for preventing care. And when they do, they try to minimize the symptoms.
So what does that mean in real life?
It means conditions that are highly treatable when they caught early, like hypertension, diabetes, high cholesterol, prostate issues, even certain type of cancer. They get caught late in men because they never went to get checked. Early detection is not optional, it's survival.
So I repeat, early detection isn't optional, it's survival. We need to hear that.
There are cultural components too. In many cultures, and especially in some areas like Balkan, cold Gulf area, men are conditioned to be strong, not to complain, to push through. There is a stigma around admitting vulnerability.
So I see this also in the clinic constantly. A woman come in with a list full of symptoms and they have questions all the time. But when men come, actually, they barely never say anything. Something is seriously wrong, and then they just downplay it.
Yes, and think that the Cleveland Clinic survey found that a significant proportion of men would rather do almost anything, including household things that they hate, than to go to the doctor. That's not toughness, that's a health hazard.
And that sounds scary, really. Should men be worried?
They should be motivated, not scared, but motivated, because almost everything we are going to talk about it is preventable, treatable, or manageable if you catch it early and you take action. And here's what we are covering today. The prostate, what every man should know about cancer screening, prostate hyperplasia, and the PCA debate. Heart, why men's cardiovascular risk is higher and what to do about it. Sexual health, testosterone, libido, fertility, and some prevention protocols. What to screen for, when, and how to build a routine that actually protects you.
So let's start with the one topic men avoid more than any other.
The prostate.
Yes. That sounds scary for probably many of them, but should men be worried?
They should be motivated. Almost everything we are going to talk about today is preventable, treatable, if you catch it early, as I said before. So the prostate, think that it's about the size of a walnut, okay, and it sits below the bladder and surrounds the urethra. It produces fluids that nourish and transport sperm, and it enlarges with age. It compresses the urethra and makes urination more difficult.
So put that into normal language. So it's part of the reproductive system, but its location means it affects the urination too. Exactly,
and the most common condition, it's it's called benign prostate hyperplasia. Yeah. Okay? It's simple. The prostate gets bigger. You don't have cancer. It's not dangerous itself, but extremely common and affects the quality of life. By age of 50, about half of men have some degree of this. By the age of 80, up to 90%.
Can you mention some symptoms?
Frequent urination, especially at night. You're getting up 2-3 times. A weak stream that starts and stops. Difficulty starting urination. And feeling of incomplete emptying. You have urgency and dribbling.
So tell me, George, how bad is it?
For many men, annoying but manageable. For others, it significantly affects the sleep, daily activities, and quality of life. And occasionally, severe benign prostata hyperplasia can cause urinary retentions. This means that you have the inability to urinate, which is a medical emergency. So, annoying today can be urgency tomorrow. Don't wait.
So annoying today can be urgent tomorrow. Just go and get it checked.
Exactly. And treatment arranges for a lifestyle modification and medication to minimally invasive procedures. Earlier is always better. You have more options. Think, another under-discussed condition is the prostatitis, okay? Inflammation of the prostate that can affect younger men, usually even in 20s or 30s, and it's the most common type of chronic pelvic pain syndrome. Has not identifiable infection, but causes pelvic pain and discomfort. Many young men with those symptoms don't realize it's a recognizable, treatable medical conditions, and usually they suffer in silence.
So if a man is getting up twice a night to pee and just accepting it as getting older, what do you say?
He should know that's not something that he has to live with. There are medications that can relax the prostate or even strengthen it over time. There are minimal invasive procedures which take minutes. The key is getting evaluated. Most men just suffer because they are embarrassed to bring it up and, of course, to get examined.
Which brings us back to the I'm fine problem.
Exactly. It's the recurring theme of this whole episode.
Now to the big one, prostata cancer screening. Very important one.
I think prostata cancer is the most common non-skin cancer in men. About 1 to 8 will be diagnosed. The primary screening tools is the PSA test, a simple blood test. But here's where it gets complicated.
Translate this for someone who sits at home. There is actually a debate about whether to test.
You know, PSA is prostate specific, but not cancer specific. It can be elevated from other conditions like prostatitis, recent ejaculation, cycling, or even hyperplasia of the prostate. You know, this large prostate. So the consent PSA screening detects many slow-growing cancer that will never cause symptoms or death. Okay, treating those can cause significant side effects. incontinence, erectile dysfunctions, for a cancer that may never have been a problem.
So what's the current recommendation?
The current consensus is that men between 55 and 69 should discuss screening with their doctor. Higher risk, it's family history, African American heritage, those start discussions when they are like 40, 45. Over 70, routine screening generally is not recommended. But so you should start early. Screening is a conversion, not a checkbox.
So screening is a conversion, not a checkbox. Talk to your doctor, don't just skip it.
Yes, and if the PSA is elevated, don't get panic. It does not mean cancer. The next step, of course, your doctor will guide you and probably, repeat the test. Maybe they will make some other test and some other like maybe biopsy or MRI, but the most important is to get checked, okay? Not and don't think that if you have like cancer or something, you need to get treatment immediately. Not every prostate cancer needs immediate treatment, okay?
What about the cardiovascular risk?
You have heart disease is the #1 killer in the men worldwide. Men will develop it like 7 to 10 years earlier than a woman.
Why is that gap?
You have several reasons. First, you don't have the estrogen buffer. Premenopausal women have cardiovascular protections which men don't have. Second, the visceral fat distribution. Don't forget that men store fat around organs, this apple shape, which is far more metabolic active and inflammatory than subcutaneous fat. Because of that, many people you hear, they say you have to lose your fat. The third, you have the behavioral factors. Men, they smoke more, they drink more, they manage stress less. And the fourth factor is screening delay. Hypertension and high cholesterol get caught later in men.
And what does that mean for a man in his 40s?
It means a 45-year-old man who feels fine maybe already have significantly coronary plaque building, for example. Heart disease does not announce it itself with a warning shoot. The first symptom for many men is heart attack, unfortunately. And don't forget that heart disease whispers before it screams.
I repeat, heart disease whispers before it screams.
So it's motivating because the whispers, the high blood pressure, the high cholesterol, the high blood sugar, high inflammations, are all detectable and are all modifiable. Think that metabolic syndrome is a cluster that dramatically increases the risk. Okay? Think waist above 102 centimeters, elevated triglycerides, low HDL, elevated blood pressure, elevated fasting glucose, sometimes it's called also pre-diabetics. 3 or more of these qualifies. They affect about a third of adults in developed countries.
So, okay, translate this for someone at home. Big belly, high blood pressure, blood sugar creeping up.
That's a metabolic syndrome territory. It's not just a risk factor. It's a multiplier for heart attack, stroke, type 2 diabetes, and a certain type of cancer. Here's the minimum cardiovascular panel every man should have by the age 30. You need a full lipid panel, you need a fasting glucose with HbA1c, you need blood pressure measurements properly, you need the high sensitivity CRP we have discussed before, weight circumference, and ideally fasting insulin. It catches insulin resistance before blood sugar goes up. Many clinicians don't routinely test this, but it's valuable.
So what about if a man gets all of this done? What does that give him?
You have a complete snapshot of his cardiovascular and metabolic risk. And if anything is off, you catch it early. When lifestyle change alone can often fix it. Numbers don't lie. Feelings do.
So numbers don't lie,
Nope.
Feelings do. You can feel fine and still be at risk.
Think erectile dysfunctions affect roughly half of men between 40s and 70s to some degree.
But it's not just a bedroom issue, right?
No, this is a critical point. The penile arteries are among the smallest in the body. It's 1 to 2 millimeters. The coronary arteries are about 3 to 4 millimeters. So you have atherosclerosis, plaque build up, and they show up in the smaller arteries first. Research shows that erectile dysfunctions can precede a cardiovascular event by 3 to 5 years. In men under 50, it's particularly strong predictor.
So what does that mean in real life?
Erectile dysfunction is not just a quality of life, it's a potential early warning sign of cardiovascular disease. Any man who develops erectile dysfunctions, especially before 50, should get a full cardiovascular workup. It's not just a Viagra prescription. Okay? Erectile dysfunction is a check engine light, not just a bedroom problem.
We are speaking about ED with short term. Is a check engine light. Every man needs to hear this.
And it goes both directions. The same lifestyle changes that improve cardiovascular health, exercise, weight loss, better diet, sleep, quitting smoking, also improve erectile functions. It's the same vascular system.
So a man who starts exercising and eating better for his heart might notice improvements in the bedroom too.
Yes, and that's exactly what the research shows. Weight loss, regular exercise, particularly cardiovascular exercises, quitting smoking, better sleep. These don't just reduce heart risk, they directly improve erectile function because it's the same pipes. Fix the plumbing in one place, it improves everywhere.
So that actually a very powerful motivation for men who might not go to the doctor for their heart but would go for this.
Yes, and you will be surprised how often erectile dysfunction is the thing that finally gets a man through the door. And once he's there, we watch, the blood pressure, the cholesterol, the prediabetes, all those things we have or they had ignored for another decade. So it's very, very important. The same thing with the low testosterone. The low testosterone is associated with increased cardiovascular risk, with metabolic syndrome, with reduced bone density in men, depression, and of course all of this, they reduce the quality of life.
Of course.
But, this is very important, testosterone replacement in men without true deficiency does not improve or benefit, and this can carry risk. So testing is essential before treatment.
So basically men shouldn't just buy testosterone online because they feel tired?
Absolutely not. The symptoms of low testosterone overlap with depression, sleep apnea, thyroid issues, but get tested first. If levels are genuinely low, work with an endocrinologist, urologist, depends in the country. Self-treatment can suppress natural productions permanently and impair fertility.
Why should someone care about this?
Because testosterone clinics and online prescribers are booming, especially in different countries and in fitness communities. Men walk in feeling tired, get a borderline result, and walk out with the prescriptions. But nobody checks the thyroid, nobody screens the sleep apnea, nobody asks about the mental health. The testosterone becomes a band-aid for a problem that was never hormonal in the first place. So you have to screen all the packets before you get the treatment.
And then you have another problem, they can't stop taking it.
If you take exogenous testosterone long enough, your body reduces its own production. For some men, that suppression becomes permanent. And for younger men trying to have children, exogenous testosterone can reduce sperm count to zero, literally to zero. Okay? It is devastating when a couple cannot conceive, and the cause is testosterone prescriptions he started for gym performance or social media performance.
And what about low libido? Is that always testosterone?
Low libido in men is multifactorial. We think depression, which in men often present as irritability rather than sadness. Don't forget this, irritability. You have medications, you have SSRIs, you have blood pressure drugs for those things. You have to think also stress and burnout. Okay? The cortisol suppresses testosterone. You have to think poor sleep. Even 1 week of 5 hours sleep can reduce testosterone by 10 to 15%. You have to think work issues, relationship issues. So, to treat the low libido as a signal, but not a standalone issue.
What about fertility? Because men assume that's unlimited too.
Male fertility, it depends on sperm quality, and sperm quality has been declining globally. You have the obesity, the heat exposure, endocrine disruption from plastics, smoking, alcohol, and of course age contributes. Everything contributes. For men that planning children, maintain healthy weight, avoid excessive heat, especially to the testicles. Okay? Limit the alcohol, no anabolic steroids, which can shut down sperm, and of course reproduction. So fertility is not forever, but you have to plan ahead.
So fertility isn't forever. Plan ahead, even for men.
Exactly. And I think that you can use a practical protocol, especially for the young ages, 18 to 30, blood pressure every 2 years, it's baseline, baseline lipid panels, blood sugar if you are overweight or you have a family history, and you can have like testicular self-exam if you see something that should not be there. If something changes in your body, you have to talk to your doctor. And of course, mental health, very important. After for the ages to 30 to 40, we always ask about the full lipid panel every 3 years, 5 years, depends on the age, HbA1c, fasting insulin, which is a metabolic risk factor, testosterone if it's symptomatic, and of course baseline skin check for moles in general for all the people.
And then the critical decade?
It's age 40 and 50. Thank you for this. I'm not a critical yet. Wait.
Almost.
Almost. So here we have, the PCA discussions at 40, 45 age. It's a high risk. Cardiovascular risk assessments, ideally you have the coronary artery calcium score, colonoscopy, especially after 45, diabetes screening every 2-3 years, and of course, ages 15 plus, PCA, you should do it, colonoscopy again every 5 years, bone density if you have risk factors, abdominal aortic aneurysma screening, especially for people that they smoke, lung cancer screening if you have a smoking history, it's also very important. In general, it's important to schedule, depends on the country and the culture. We do like every year, every 2 years. You have to have a full checkup.
So schedule your health like you schedule your car. And one advice from me to you.
Exactly. Schedule your health like you schedule your car. Usually we go to the car for a service, and we want to take the car to be washed, to be clean, but we forgot our body.
Yeah.
And your body needs maintenance too. Don't forget this. And of course, beyond screening, you need to have a daily protocol, like resistance training, like go to the gym with resistance training, 3-4 times per week, compound movements. It's very important because every of this, every exercise protects and to maintain the muscle mass, the bone density, the testosterone levels, the insulin sensitivity, and of course try to eat protein at least 1.6 grams per kilo, and sleep at least 7 hours a day, 7 to 9. And I don't know how, but it's the most difficult, I think, nowadays. It's to have a stress management. And for people that they smoke, please stop smoking and try to limit alcohol.
So, an important question. Why resistance training specifically? Why not just cardio?
Cardio is important, but resistance training does something unique for men. It maintains the muscle mass, also for the woman, but today we spoke mostly for men, which naturally declines after the age of 30. And on this, it supports also the bone density. So it improves insulin sensitivity, and it supports the natural testosterone productions. And this one is the strongest predictor of longevity and independency in older age. Okay? Think that if you have muscles, you can come up, you can go to the bathroom. I know that many people, they think, I can go to the bathroom today. I see people every day that they cannot come up, or they need crunches to walk. You need muscles to keep up your body and walk. When we operate like prosthesis, like hip prosthesis, the same day you have to come up. If you don't have muscles, you're overweight, it's very difficult.
So it's not about looking good in the gym.
No, it's not about looking good at the gym. It's about being functional when you are 70, 80, or 90. The muscle you build now is the independency you keep later. Okay, this is very important. People, they want to look nice in the social media, but they forget other things. And if you only do, 3 things like blood test, okay? Check the fasting glucose, HbA1c, even full lipid panels, or 2, start resistance training twice per week, at least twice per week. And 3, you have an honest conversation with your doctor, and stop saying, look, I'm fine. This is the best thing that you can do as a man for yourself.
Yeah, and the 3 things, none of them cost out a fortune. No. All of them can really save your life.
Yes, and avoid mistakes. And the biggest mistake for me is that you ignoring the symptoms, especially if you have, blood in urine, chest tightness, persistent fatigue, erectile changes. And the problem is that the men, they don't talk about those things. They usually try to ignore them. So talk about these things. And for me, this is one of the biggest mistakes.
What is the second mistake?
Second mistake, self-medication, or, I just only Google and, the self-medication, especially this we have seen in younger ages. It's self-medication testosterone. Many people, they try to get more testosterone. And we see, I believe that also the social media, they don't help this, because everybody wants to have, a very nice body to show off, to take pictures. And this will create a lot of problems in the future. Okay? And this can give, of course, because you naturally suppress your natural production of testosterone, you can have potentially permanently impaired fertility. And it can give you cardiovascular risks. Okay? You have seen many young people that they were famous in Instagram, etc., that they died. For me, it's very important. Talk to your doctor and test before you treat something according to your doctor's instructions.
So don't guess with the hormone, test before you treat.
Exactly. And think also the mental health. Why? This is for me one of the third mistakes. People, they are ignoring the mental health. Men account for approximately 75% of suicide deaths in many countries. And depression in men often looks different. You see irritability, you see anger, you see risk-taking, withdrawal. It's not classic sadness, and usually it gets missed.
And also, like, if you get struggling, even if you can't name what it is, please talk to somebody.
We have covered this in episode 2 and 9. The low mood, the anxiety. This is not weakness. This is health. And I want to be very careful here. We are not saying men need to cry more or share their feelings in a specific way, because it's also cultural. Everyone processes differently. We are saying that if something has changed, your sleep, your interest in things, your patience, your energy, don't assume it's just stress. Get it evaluated. Depression is treatable. Anxiety is treatable, but only if someone knows about it.
Yeah, and sometimes, like, people around you notice before you even do. So if someone really cares about you, says you seem different, listen to them.
Yes, and many people they try to avoid it and they try to do other things, like overtraining, for example. I go to the gym every day. I go to the gym every day because I am stressed and I want to take it out. And here it's the fourth mistake: the overtraining without recovery. The people that they do intense exercise without adequate sleep and nutrition, which increase the cortisol, which suppress the testosterone and increase the injury risk. So always have the recovery, because recovery is a part of a protocol.
Yes,
not
definitely.
A break from this. Yes,
recovery is the part of the protocol. So rest is productive.
Yes, and don't forget that it's very important. You fix your muscles, you develop your muscle when you rest, not when you are training. When you are training, you give the stimulus. When you rest and you eat well and you sleep well, you have the recovery. And especially for people in the Gulf area, try to train early in the morning, especially when it's very high the temperatures. Try to drink 2-3 liters at least daily, plus electrolytes the days that you have extreme heat. In Ramadan, resistance training can continue, but ideally it's to cut it like 30 minutes, 40 minutes, okay? And usually 2-3 hours before or after iftar, and protein first at iftar, and so on. Reduce the volume, but you can maintain the intensity. People that they smoke shisha, it's not safer than the cigarettes. Don't forget this. Research estimates that a single season expose you like 25 times the tar and 10 times more the carbon monoxide of a single cigarette. So the cardiovascular and the cancer for risk cancers are significant also there.
And what about the screening programs in Gulf?
Don't forget that Gulf countries have excellent screening programs, okay? Especially, Saudi, UAE, and Qatar. They have amazing preventive health programs, and they are world class. But you have to speak to your doctor. It's very important.
And what about the social meal culture?
The Gulf social culture involves, usually large and late meals. Okay, like it's the same like Balkan. We have, it's
you
like
eat until you die.
Yes, exactly like this. So there, you try to choose grilled proteins over, fried food, minimize heavy desserts, and it's a huge discussion about the breakfast, okay? Some people, they say, don't skip the breakfast because breakfast means break the fast, and some other, it's like they say skip the breakfast to save the calories for the dinner. So for me, it's better to stabilize, like if you skip the breakfast, you can eat your calories all day, but don't try to make it like one portion, like huge, that after you cannot move. So it's like try to keep it in small protein-rich meals.
So basically, eat breakfast like a normal person. Revolutionary advice.
Yes, for us, we don't eat breakfast. We have cut it. But if you eat breakfast, yes, try to eat like a normal person. Because usually, they try to eat as much as they can, and after they eat only once at night.
Yeah. Okay, so when should a man see a doctor urgently, speaking about something else?
I think blood in urine or semen, this needs evaluation always. If you have chest pain, especially with exertion, if it comes, this is emergency. If you have any testicular lump or swelling, that comes. Testicular cancer is most common between ages 15 to 45, with cure rates above 95% when it's caught early. So it's good to have a monthly self-exam in the shower, Don't afraid to check yourself. If you have sudden erectile dysfunctions, especially under the age of 50, do also a cardiovascular workup. If you have persistent urinary changes when you are over 40, think simple, talk to your clinician. If you are over 40 without blood work in 2 years, make new ones. Think about urinary symptoms, family history, it's very important. Talk to your doctor, make a program what you have to test and just test it.
Okay, George, it's time to jump to the personal takeaway.
Okay, my personal takeaway is that I have lost patients who are waiting too long. Okay, and I have seen people that they were waiting too long. I have lost family, and many people of us, especially in Balkans, they were waiting too long. Not because they had untreatable diseases, but they came in too late. So they thought being tough meant to be silent. So being tough means showing up, getting tested, making changes. That's the real strength. A real strength is showing up, not staying silent.
Real strength is showing up, not staying silent. I think that's my favorite law from this episode. So, my take. As a woman in the room, I love men in my life and I need them to be here for a long time. So, the woman listening, you have a permission to push. Send them this episode, book them an appointment. Ask the question they won't ask. Sometimes the most loving thing you can do is refuse to accept, I'm fine.
Yes, and it's very important to have to check your people that you have close to you. And I know that in this episode we covered a little bit uncomfortable topics like prostate, erectile dysfunctions, mental health. But those are the conversations that the men avoid. But avoiding them doesn't make the problem go away. It just means you find it out later, when there are fewer options. The bravest thing you can do this week is not the gym. It's picking up the phone and booking an appointment with your doctor. Talk to your doctor.
Yeah, or just letting someone who loves you book it for you. That counts also.
Yeah, that definitely counts.
So to the woman again listening, you have a permission to push. Send them this episode. Book the appointments. Sometimes the most loving thing you can do is to refuse to accept, I'm fine. Remember that. You get sick once.
And to the men, you are worth the effort. Your family needs you healthy, not just alive, healthy. Very important. Stay there for them. Get examined for them. There are solutions.
And a quick recap.
So, I will start.
Okay,
What is the problem? The men live shorter. You have delayed screening and ignored symptoms. Think prostate. Most of the things are treatable. Think about sexual health. Erectile dysfunctions can be vascular warning. So test. Speak with your doctor. And every country and every doctor has the plan about the testing. Speak with them. Don't avoid. Book a blood test, book an appointment. This is the most important for me. And start with resistance training. It's very important. 2-3 times per week at least. And have an honest conversation with yourself, with the people that they are close to you, and with your doctors. Sometimes, men, they try to avoid to speak about how they feel, what they want to do, that they have pains, etc. Stop this. Speak free. It's not weakness to speak.
Okay, start there, build from there.
Yes, and that was the Man's Health Masterclass.
So share it, tag him, send it to his phone. Sometimes the message has to come from someone who actually cares.
And in the next episode, we will talk about the woman's health.
And until then, get tested, get moving, and stop saying I'm fine when you're not.
Very important. Bye.
Bye.